Chapter 5 gets into drug classification. Chapter 5 really is where I think it starts the most important stuff as radiographers. The first 4 chapters were basically an introduction to pharmacology for us, giving us some basic information. And now we're actually getting into the name of drugs and what they do. And I think knowing this information makes us a much better radiographer. History taking is an important piece of what we do. We are the only connection between the patient and the radiologist making the diagnosis. Oftentimes the radiologist never sees the patient. So it's important that we take a good history, and sometimes medications are a part of that. Beyond that, if I know a patient is on a certain medication, it leads me to kind of know what their history is or what their medical condition is, so that I can be a better practitioner. I can take better care of that patient and maybe anticipate some things that may go wrong if I know what kind of medications they currently take. Again, look at the objectives so you can kind of guide your learning before the quiz. Page 54 starts out with cardiac medications or antiarrhythmic. This we give to people because their heart is out of rhythm. So if someone is on an antiarrhythmic, it wouldn't be uncommon for them to say, "Oh my goodness, my heart is racing." And we might not overreact to that because we have a history of this. Of course, we would evaluate them further or contact a radiologist to help us out, but just by them telling us that any of these medications listed at the bottom of the page, once we know they're on one of these medications, we would know that abnormal arrhythmias would be normal for them. Antihypertensives are very common. There are a lot of people in America that have high blood pressure. If someone is on an antihypertensive, it's to bring their blood pressure down. Again, it's very important to know this because doing IVUs or a kidney function test can be affected by this because hypertensive people have a lack of kidney function, so there could be a correlation there. Diuretics, they are also known as the water pill. If someone has swelling built up in their feet and ankles, they give them a diuretic. Anticoagulants on the next page, page 56, are used for patients who have a history of blood clot formation, and this would cause their blood not to clot. So these people, if they were to fall on our x-ray table or cut themselves, they may bleed a little bit more than normal. And some of these drugs need to be stopped before certain tests or procedures. Analgesics, down at the bottom of page 56, a lot of us take these frequently to take the pain away, whether it's a headache, arthritis, or whatever. They are very common. Narcotic drugs are listed on page 57. These stimulate nervous system receptors, and they can be dangerous and addicting if not taken properly. Acetaminophen is very commonly called Tylenol. That's at the bottom of page 57. Its long-term use of high doses can cause renal and cardiac damage. Antihistamine medications are on page 58. These medications block a histamine reaction. Benadryl is one of the most common one you will see if anyone is having an allergic reaction. The patient will be given an antihistamine to stop that reaction. On page 58, it goes into endocrine medications, anti-diabetics type of information. Some of those drugs also need to be stopped before we can do our exams with contrast media. Metformin is an example of this. Every hospital has a different protocol for certain medications, so double check on that with your hospital. Metformin is very important to document. Central nervous system medications are listed on page 59. These are, again, if I know my patient's on some of these, it can lead me to be a better practitioner and give better care. If I have a patient that has seizures, I can anticipate it and not be shocked when it happens. Antidepressant medications or anti-anxiety may lead me to think that they need a little extra TLC, and there's nothing wrong with that. Antibiotics are discussed on page 60. Those are pretty common. And then they lead into chemotherapy agents and herbal products, again, are discussed at the back of Chapter 2. But again, I can't stress enough how important it is to understand that herbal products are also considered drugs, even though we don't routinely consider them drugs because we don't need a prescription to take them. The learning activities are on page 62 and 63. Go ahead and complete those as you prepare yourself for the quiz on the next section.